cost effectiveness is a critical element, especially when you have a more costly treatment that you're trying to bring to the patients. We have to be able to determine, not only that we're going to improve their outcomes, but that it's cost effective, especially for proton therapy, that, building these systems is extremely expensive, and we need to make sure that we can justify that expense. So there are different elements that patients go through in their journey of treatment. Initial reaction, of course, but once you start that treatment, patients are typically around the average age of our patients was under 65. So the majority of patients were under 65. The median age was about 61. So these are patients that are not retired and are at the peak of their projected outcome in terms of productivity in their life, right? This is phases of importance. They want to continue to work. They're not looking to take time off per se. And this is a major disruption in their lives and also the family's lives. Usually if they have families, their kids are moving into high school and moving into college age. And some are less than that. They're, in elementary. So these are families that are, looking to continue to maintain that sustenance and continue to grow. And so when patients have to have feeding tubes, as I mentioned before, that's an assessment of total toxicity burden. That means that they simply cannot eat enough food, drink enough water, control their pain to be able to sustain them. And clearly they're not going to work when they're having a feeding tube.
Right.
And so that all of a sudden, from an employer standpoint, that has cost implications because now you've taken a productive employee and pulled them out of the company, so to speak. And sometimes, these people might be running their own companies. That has impact. For families, the spouse or the significant other is now trying to become the caretaker for these individuals. And so many of these are double income families. And so now you're compromising some of the care, and some of these patients have to take, some of these caretakers have to take FMLA.
Yep.
So that also impacts employers in that of them,
right,
even though they're not the patient.
Right.
So because they got to take care of the patient. So I think those are two elements of economics that we're trying to model and better understand.
And those are costs that don't show up in the direct cost of care.
That's correct. They do not show up in the direct cost of care. But
it's still a measurable cost to society.
It's a measurable cost to society, and it has financial toxicity to the patients.
Right.